explain about the sequence of LBBB. Septum depolarizes abnormally from right to left. Right ventricle depolarize first. Left ventricle depolarize late via slow muscle conduction. Because the left ventricle has greater muscle mass, delayed activation produces large and wide QRS complexes. Repolarization becomes secondarily abnormal, producing discordant STT changes.
So I'll explain about ECG diagnostic criteria. In ECG diagnostic criteria, QRS duration is about greater than 120 millisecond, broad notched R wave in lead 1, V5 and V6. This represents delayed LV activation. The notching gives M-shaped appearance. Deep wide S wave in V1 to V3 because depolarization moves away from right tricordial leads. Absence of Q wave in lateral leads, important diagnostic clue. Discordant STT changes, ST segment and T wave are opposite in direction to QRS.
So I will be explaining about the incomplete left bundle branch block. So here the QRS will be, the duration will be somewhere between 100 to 119 millisecond, and less common than incomplete right bundle branch block. It is kind of rare, and it also may progress to complete left bundle branch block. So I'll also explain and mention the causes for this left bundle branch block. So firstly, there are structural heart diseases which are long-standing hypertension, coronary artery diseases, dilated cardiomyopathy, and valvular like aortic stenosis as well. And then there are degenerative causes which will be fibrosis of conduction pathways and age-related.
Okay, sometimes it may be due to post CABG surgical issues also. So if it is skipped a beat or trigeminal, trigeminal also combined with LBBB. So it is post surgery also one of the most common causes for LBBB.
So I'll explain about clinical significance. LBB almost always indicates underlying pathology. New onset LBB with chest pain is highly suspicious for acute MI.
Okay.
It also causes ventricular dyssynchrony, which can
leads to heart failure also. Yes, which is indicating mostly ischemic heart disease patients also having LBBP. That is the reason either in acute MI or in a post MI or post surgery will also indicate that as a conduction is very worsened. Okay, there is an heart failure because congestive will be happening there. So it indicates heart failure. So most of the causes are acute MI or post CABG or severe globular conduction abnormalities.
As mentioned, the prognosis and management.
Okay.
So this condition is often associated with poor prognosis, and it may require a pacemaker at times. The cardiac resynchronization therapy in heart failure, so this is also something that can be used to treat this, and mainly you can treat the underlying diseases which is causing the condition in the first place. So that is also one of the management.
Okay, maybe it is due to valvular heart disease, or maybe it is due to by congenitally also it may be happened. So it is congenital heart disease or whatever it may be, valvular heart disease post CABG at all. So underlying causes means it may be first we have to treat what are the condition will cause LBBP, then it is neither pacemaker or CRT. Okay. Here the final summary about LBBP and RBBP will differentiate about their features including pathology or ventricular effector and conduction effector and MI detection prognosis. Here about
So basically the severity of left bundle branch block is more significant and more severe than the right bundle branch block because it's often more mild. And the ventricle affected in both the conditions are similarly left bundle branch, here it is affecting the left ventricle, and in the right bundle branch block the right ventricle is getting affected.
Okay.
And in the case of left bundle branch block, the detection of MI is quite difficult
because there is some primary presence of STT changes may be also accompanied. So it is maybe difficult when comparatively RBBP. Okay.
Yeah. So and the prognosis of left, it depends on underlying diseases. So whatever underlying condition is there that is causing that
Okay.
So that is whatever the prognosis is, it depends on those conditions. And for right bundle branch block, it is usually good and it is easy as well since it is it's
compared with a very congenital disease also, which maybe does not cause much more severe than left. Okay, fine. So thank you.